Okay, welcome everybody to the Democrats Abroad Environment and Climate Crisis Climate Cafe. We are thrilled to do a joint session today with the Disability Caucus, and we want to discuss and explore the intersection of the impact of climate change on people with disabilities. People with disabilities, as I didn't know, they comprise 15% of the world's population. And they are both the most vulnerable and the most overlooked population when it comes to addressing the effects of climate change. According to the United Nations Environment Program, people with disabilities are more at risk in the case of disasters due to a lack of education, due to existing health conditions, and difficulty evacuating to safety. Furthermore, the disabled people are more likely to experience poverty, which further exacerbates these risks. Following any occurrence of a disaster, people have limited access to necessary resources and services, including life-sustaining care, and many people will become newly disabled as a result. For all these reasons, it's imperative to include disability, especially multi-marginalized disabled people, in a work-focused and protecting the environment and preventing climate change. I'm so pleased to have several members of our Disability Caucus with us today. Marnie Delaney, who is our chair, who is calling in from France, and Elizabeth Blackburn, who's joining us from China today. I think it's quite late for her, and Ken Sherman, who I believe is calling in from Canada. They'll share with us some interesting perspectives from looking at their context and situation, and I hope that all of us can ask questions and engage and learn together through sharing our mutual experiences. So with that, I will hand it over to Marnie.
Thank you, Dana. Yeah, thanks for having us for a conversation today. I love a conversation as opposed to a big speech, but of course I will talk for a few minutes. This is particularly a relevant and compelling subject for us because really the nature of disability by its definition involves a disruption of the relationship between a person and their environment, which results in somehow decreasing or increased difficulty in functioning within that environment. So sometimes that disruption results from within, comes from within the body, like with cystic fibrosis, with the CFTR gene, or with hemophilia. Sometimes it comes from without, like an influence resident in the environment, like neurotoxicity in PCBs or other chemicals or cigarettes or alcohol that often lead to cognitive impairments, or from violence, whether in personal or national conflicts or childhood abuse, for example. Almost always, though, these disabilities are daily exacerbated by environmental factors like temperature, air quality, water quality, and so on. These notably include autoimmune diseases like multiple sclerosis or lupus. I have both of these, and both can be set into overdrive by things like exposure to UV light, which we commonly call the sun, heat, viral illnesses, infections, exhaustion, stress, or what we could call the summer of 42, or 22, well, not 42, 22. The CDC reports, and I apologize if I repeat any of your points, but whatever, it's good to remember. The CDC reports that 1 in 4 adult Americans, 26%, or 61 million Americans live with a disability, plus over 3 million children. Actually, around the globe, that's 240 million children living with a disability, which I think that's a good picture to put in our minds when we think about dealing with major disasters. That's a lot of kids. And it makes the challenges no less severe, whatever our age. So of all of those adults in the US with a disability, 1 in 7 have serious difficulty walking or climbing stairs. That would be me. 1 in 9 with cognition, like concentrating, remembering, making decisions. That's a critical thing to think about. 1 in 15 have trouble living alone, doing errands on their own, and so on. 1 in 17 have deafness or severe hearing loss. 1 in 22, blindness or severe loss of sight, I know. And 1 in 27 have serious difficulty just dressing themselves or bathing themselves, taking care of themselves. So these people already have a disrupted relationship with their environment, and a unique a combination of barriers and challenges just to living daily and maintaining a job, if they can get a job, which is a whole other problem, and optimizing their health just to survive. So the level of success they can achieve is determined largely by the kind of services available to them and the extent to which the physical and the built environment are accommodating to them. And that's one thing that I think is always really important, is that it isn't just people with a disability that need to accommodate to their environment. We really, as a society, need to think about accommodating our environment to people with disabilities. I digress. It also drives, this also drives the social and psychological environment, this whole relationship, and that can impact both physical and mental health. So, okay, on top of all that, let's add the disruption, the severe disruption to the environment, the climate, extreme temperatures, floods, all the things you mentioned, fires, famine, drought, that result in power outages, unsafe or no water, food shortages, medical supply shortages, unchecked spread of disease, failures of technology. What happens to people with disabilities who are disproportionately, as you said, living in poverty, so already have fewer resources and fewer layers of protection? What happens to those who are dependent upon the immediate accessibility of healthcare or assistive devices, which may have to get plugged in, medications that have to be taken? I have to take something every day, and almost everybody I know does. All those sorts of research. What happens when you can't climb stairs or get up to the top floor and onto the roof of the building to avoid a flood? What happens when you don't have a job, so you don't have that connection to any kind of workplace community that's going to help take care of you, or you're isolated and for other reasons from the community, which is often the case with people with disabilities. Our membership, again, lives around the globe, so it's not just Florida and the little places in Texas and California that we worry that people are talking about. Some of the situations with climate are obviously super immediate and very, very intense, as we are seeing this summer. So this is why we need to be why the disability community needs to be part of the voices raised to the US government, insisting that the global climate realities must be addressed by and with global leadership, by US leadership. I'm going to say this in a better. US leadership has to take a leadership position in dealing with global situations and the global climate crisis. You can't fix one country without fixing all of them. And so we need to establish credibility and a plan of action. I'm just going to mention in 2018, United Nations published this report, which addressed disability and sustainable development goals. And I think basically what it said was, people with disabilities are at a bigger disadvantage than can be at a bigger disadvantage when it comes to climate change. And we really should have a plan of action. And I think I'd challenge anybody to suggest that that's happened since 2018. I don't think I would fail the quiz if we had to say what they've done. So I think the disability community needs to face the exponential suffering that people in our community that it will result from the overall lack of commitment, action, and preparedness in the face of this clear and present danger from the climate crisis. And we know that we don't have any time to fiddle around and need to build action. And people with disabilities need to be part of those discussions. They need to be considered in the plans, and they need to be proactively positioned for survival in what we can anticipate and what we can't anticipate. And I'm going to just a little, so yes, so we need to be involved, and we need to be involved because we need to do something, and we need to be involved because people need to think about what we need. And one of the things I'm going to bring up as an example of that, I know you've probably already heard this a million times, but that whole ableist plastic straw argument, which is plastic straws were invented so that people with certain conditions could drink things and eat things, but mostly drink things. And it was to prevent them from those little bendy straws, from aspirating fluids into their lungs. If they don't have that, there are a lot of reasons why other kinds of straws don't always work, a straight straw in particular, but there are a lot of issues around that. And that is that's the sort of obvious argument for having a discussion so that there can be exceptions to very sensible actions that are taken. So a good thing for the environment, get rid of plastic. A bad thing for people with disabilities, get rid of bendy straws. So maybe maybe every restaurant gets to have a little plastic bendy straw section hidden in the back. I don't know how we make it work. This is a discussion. We can talk about it. But that's the kind of thing where it's important to have people in the discussions who understand the implications for everyone. And that's all I really wanted to start. I just wanted to start off the conversation with a few basic thoughts.
That was a wonderful start, and there's so many aspects to explore and learn about and really understand better. I think that I have a ton of questions and comments, but I want to save them because I want to hear from everybody. But thank you so much, Marnie.
You're welcome.
As usual. It was
Thank
really
you.
inspiring. I don't know if was Ken or Liz going to go next. Is Liz, did you get the slide situation worked out?
Sure. Hi.
Hi.
Yeah.
Can you share the slides yourself?
As always, absolutely. One moment.
The link asked me to get permission to have it, so I sent you the thing back.
Let me do that now. Apologies for the delay, everyone.
So with voting, I'm going to say disability voting rights week is coming up, and while Elizabeth is working on that, I'm going to mention that it would be great if you could volunteer, everyone on the call, if you could volunteer to help somebody with disabilities if they should require it, with things like their technology, if they're trying to print their ballot or getting their ballot to post office or anything that you can do to help. That would be great. Okay, I'll set Elizabeth.
All right. Let me know if you can see it.
We were able to see it, but it went away.
Yeah, I'm dealing with a few internet issues.
Beautiful graphic, Liz.
Okay, how's that?
Perfect.
Great, wonderful. So we are focused on building for a better future, and thank you for having me on today. I don't claim to be an expert on climate change or even disability for that matter. I'm merely a disabled American who happens to care deeply about the impact my decisions have on the environment. And for this reason, I lean left and vote blue. I advocate for environmental justice and increased accessibility for the disabled community. Today, I'm going to start a conversation off with a focus on emergency preparedness, which is so much more than a flashlight or a first aid kit. And we really take for granted that every household has that to begin with. as Marnie was alluding to, we're struck by major climate events from floods to fires, heat and cold extremes, and we need to learn who is at the highest risk and how to help. And certain segments of Americans are least likely to be prepared to take actions when faced with natural and man-made disasters. Households led by women, those with children under 18, renters, and those of low socioeconomic status. BIPOC communities across the board are all less likely than others to be even minimally prepared for disasters. And so how do we change that? How do we prepare? You have to ask questions first, right? And think about how will you get to safe place? How will you reconnect with others? And really inform, acknowledge these issues and address them ourselves and with each other. So how will you get back together? How will you contact one another is a big thing that we've seen lately with the current floods the last few weeks in America. What do you do when the electricity goes down or you can't use a mobile phone? And so we rely on ready.gov and FEMA for some of these answers. And it's important to ask these in advance of the disaster. And we have a few tips too for medication. Talking to your doctor and pharmacist in advance, storing extra drugs. Marnie was just talking about what she has. I have medicine I take every day. I have medicine I need to take every 6 weeks. And in an emergency, I really have to think, well, okay, what am I going to do next? And I didn't personally even think about it as much until we began having issues in the pandemic. I've gone back to America twice during the pandemic, once in 2020, and again at the end of 2021, start of 2022. And what I was really shocked by was how inaccessible care is right now. We're dealing with a long-term pandemic, and it is hard to make an appointment to see your providers. So that also adds an extra hurdle in preparedness for disasters and getting medication. So you need to sort of make those appointments in advance. I had to make mine a month and a half in advance, for example, this last year, and I could only see a resident in Wisconsin. I couldn't see a doctor. So we need to push for a little bit of change there as well. And then we have medicines that we don't really think about. Some of them require refrigeration. Some of them require a syringe or something to administer them with. And how we take care of and dispose of those and keep those safe while we're in transit in an emergency situation is really time consuming and obviously takes a lot of preparedness. Then we have tips for people who are hearing impaired, which could include a weather radio. I don't know if any of you have had those. My mom used to have one of those, and they are loud and they are blaring, and you can also adjust them as needed. And I believe most of them, if not all of them, even flash, which is really nice because if you are hearing impaired, that might trigger a reaction to pay attention, to take notice. There's a few ways they act to inform you if you have a disability. And I think that the thing that we're least aware of, one of the most central things about being prepared is communication. Communication is a huge barrier for so many of the disabled community. And even when you're able, how do you know how to ask for help? How can you ask for help? It's hard. And so informing your community and those around you, letting them know that you're nonverbal or your loved one is nonverbal, or your vision impaired, and maybe you can't read all of the signs and follow everyone according to where they're wandering. You need to keep a communicative response as you go through these efforts. And go. We also have tips for those who are blind and have low vision, and tips for people with speech disability, excuse me. Pictograms are important. Cards with phrases are important. Making audio files in advance and keeping those in a safe place along with your medical information are vitally important to your successful emergency response. We also have tips for individuals with intellectual or developmental disabilities, and Alzheimer's and related dementia. Giving someone something they can hold on to. It's an everyday barrier we face, and in an emergency situation, even that much more valuable. And something that Ready.gov, FEMA, and others are consistently talking about in the community is how can we help by decreasing the auditory stimuli, by decreasing the visual stimuli for those who are triggered into having some sort of disabled related problem when these emergencies strike. It's very interesting, and you know, people with individual disabilities are super vulnerable in these, and we don't exactly know how they react. So all we can do is prepare. And let's see. Mobility, I think, is probably what most people think of when they are thinking about the disabled, right? They're thinking of perhaps a wheelchair or a cane or a hearing aid. And so power in these situations is vitally important. And it takes a whole household to sort of prepare for this. So communicating with your neighbors and your caregivers, having that extra battery. And if you can't afford to purchase one, finding out and contacting other agencies and organizations, charitable or otherwise, that can help you prepare is so important. And then these are a few things that Ready.gov recommends, including a family emergency communication plan and a list of items to help you prepare. Again, those Medicare cards are very important. The Social Security website actually allows you to pay using mobile payments, which, if you can afford to do so and set that up, is extremely valuable in the case of emergency when your power goes out. And again, we often think short term, right? Maybe a tornado rolls through and we think, oh, it's past, it's no big deal. But if it actually hits us, that could affect us for 6 weeks, 8 weeks. In the case of a hurricane, it could take years for us to clean up. And that infrastructure and those resources are not always there. So we want to make sure that these agencies who are collecting payments and various things, we're ready for them also, because things don't always stop when the electricity does because of a flood. And again, that's ready.gov. Stay informed, make a plan, build a kit, get involved, and share some of our hashtags. These are the ones they recommend in terms of sticking together on the disabled preparedness front. We prepare. And are there any questions about building a kit or dispersing information? I can answer them after or right now.
This is a fantastic, Liz. And I would love to collect this information on your kit and add it certainly to our toolkit that we provide in our web pages for addressing climate change. Fantastic idea.
Yeah, and we're not there, but as Democrats, I love that we're focused on the inclusivity. So I hope these tips can be shared. I hope we can reach a more equitable lifestyle and level of preparedness. So contact me for information after our call as well through the Disability Caucus. And then as Democrats abroad, we need to inform Americans everywhere that they can prevent and prepare for these disasters, and that voting in 2022 for candidates up and down the ballot is going to make an impact in environmental justice and the lives of our disabled and disenfranchised communities. So thanks, Dana. Thanks, everyone.
And I see from that Sharon has made a suggestion to look at the preparedness kit used in San Francisco. Also a really good idea.
Yeah, Sharon, I have to tell you, if you're San Francisco, that's where I vote. And I was in San Francisco. I lived in the marina during the earthquake of, oh geez, it's going to be the last century, 1989 or whatever it was, 89. And the building across the street from me just completely collapse. And I am so, I'm so aware of what it can be like just to try and get home or try and get away from home or try not to have food. But you're right, we should look at what anything San Francisco has is probably excellent, because we used to get every kind of disaster.
Unfortunately, I'm not from San Francisco, but I saw a program about it and was so
Yeah.
impressed. And it's
Yeah.
something that I'm just wondering, since we are around the world, and seeing the horrific things that are going on now. I mean, look at Pakistan. Does anybody know, and I don't have any connections at the moment with the UN, whether the UN has an emergency prepared kit plan, or does Oxfam that can be used
They
around the
have one
world?
planned. They have one planned. I was just
Right.
looking at this. Well, in 2015,
That's
the United
trouble.
Nations Office of the Commission of Human Rights created a list of obligations for
Uh-huh.
governing bodies to follow to ensure that climate change was rooted in equity. And so there's a list, an inclusive preparedness plan, saying that it should include, it doesn't give it for each country, but if you're, and I'm sorry to interject this now, but you asked this question, and then I want Ken to
No, it's a
speak.
good point. No, please.
It says there are about 8 points. There should be in this, the UN says in this preparedness kit, that a framework for educating the disability community on disaster response, 1, a disaster response education for caregivers and other household members, 2, an equitable resource distribution plan, 3, an inclusive community level resilience office, followed by rescue groups trained on providing accessible rescue strategies, risk assessment and planning for proper identification of vulnerable people, community level dissemination plans that allow for disbursement of information related to impending or ongoing disasters, and finally, guidelines for dissemination of information between various levels of government. So that's what they say.
Okay, I'm going to just
That's
throw
pretty-
something. I'm going to throw something in on top of that, and that is geez, Louisa, it was in Forbes magazine. They spoke to the number of people in the United States who have disabilities. They also said that it was either 7 or 8% of those people you are invisible. You don't know. I don't know what word to use, but you can't tell by looking at them.
Invisible disabilities.
That they have, or they have an invisible disability, which is to say, we can't assume that in a crisis, people are going to be able to say, oh my gosh, I wonder if I should ask that person if they need help. That's why I think this proactive approach, this discussion of being more proactive is important. And the UN is really good at saying what people should do, but I think it is going to be interesting. We should do a sort of assessment of what, in our, at least our top, 30 countries or something, what is the situation in the country in terms of preparedness. I think that might be maybe we could work on that kind of a project together, just to at least make sure that the information that's out there is accessible to the people who might need it.
That's a great idea. Great idea.
Great idea.
I'm in the UK, so I'd be interested in doing something from the UK point of view.
That would be great. I'm writing
Well, I
it
think
down.
that's something that we really need to talk about, is that it is an important intervention to talk about it and plan. And so having emergency staff from firemen to policemen prepared is essential. And what are we doing in our workplaces and at home and in our own lives? Remember when you were a kid and your school would have fire drills, tornado drills, actively teaching you how to exit or stay safe, whether to shelter in place, when to leave. Those are things as adults that we don't coordinate as much and prepare in the same way. So disaster planning as that intervention is hugely important. And as Marnie was saying,
Now
the new
US schools
statistics from the
focus.
CDC.
Now they worry about being
well,
shot.
right before
Being
that,
shot,
you
it's all
basically you look
shot.
left, you look right, There is that as well, right? You do, even when I was in high school after Columbine, I think this was common for many students, you had warnings for those sort of man-made emergency crises as well, and you do prepare for that. But what would you do if you were in a situation on the street and a flood or something else happened? Would you know how to react? That's something we really need to practice and prepare for, just as I used to practice basketball every day, or you study for a test, because those, when you're in the moment and you're in an emergency, otherwise your adrenaline is rushing and everyone's rushing around you. You need to keep a cool head and go in accordance to your plan. It's essential. I know for me, every day I have to have like a little extra purse with me. I can't just walk out with a wallet or my cell phone, which over here is our wallet. I have to have a few things to help me through my day, emergency medicine and things like that. So preparing for a disaster like this and preparing for this call, I was thinking, oh goodness, well, what would I bring if this was the case? What would I bring if that was the case? And taking the onus off of the disabled community and putting it back on the community as a whole is really important there. We can't just say and point the fingers at FEMA saying, help me, or you didn't help enough after disaster. We have to say, how can we help you? And what information are we supposed to look at before? And flood insurance and things like that is unaffordable for most people, and they don't necessarily consider it in their community. You think, oh, it's like renting a car and getting insurance. Do I really need it? I mean, what are the chances? Well, again, as we know, these billion-dollar climate crises are happening now more than ever. And in the past few years, I think we've broken records, right, Dana? And as to the amount and frequency.
Absolutely. Absolutely. 1 in 1,000-year events are occurring regularly.
Yeah.
It's ridiculous. I wanted to turn to Ken before we have so many important tangents that we can build on and questions.
Yeah, 7 or 8 years ago.
I would like to hear from Ken.
7 or 8 years ago, I, with my wife, was near death with Alzheimer's. I chanced to go to her homeland in France, and I walked the Camino de Santiago that summer from the French border to the Atlantic Ocean in Santiago de Compostela. It was a 900K walk.
Wow.
And then the second summer, I was done over 31 days. And then this next summer, I walked from Le Puy, the central center of France, to the Spanish border at Saint Jean de Pied. And that was another 800 kilometers. So I had these 2 walks to reflect on my life and wherever I could meet an American on the walk, on the trail. I tried to register them for voting as an absentee. So I had, besides my backpack, 12 pounds, 12 kilos. I carried these vote from abroad cards to give the spiritual walks a political context. And today, if I try to walk 3 to 4 kilometers, I do it with great distress. I have Parkinson's, and it affects my participation to the point where I can hardly get my fingers down on the keyboard or remember which order to write a word. And I reflect on my participation as a delegate, your representative to the DNC, whether I have the capacity to function uh, without an embarrassment to the organization in my context. So it's and when we have these exorbitant heat events, I wilt, and it's hard to up and run, walk a meter or two. So it's life changes, age comes, and diseases come, and impact, and we just have to be sensitive that the person, or every person, is carrying a disability, and we need to respond sensitively to what we've been given, and pray that we make the positive changes that we wish for our foreign policy, our indebtedness to nature. And anyway, I'm thankful to you all for raising these issues, and I hope we can work well together and deliver on the democratic values that we so dearly uphold.
Ken, we always want to just do our best, and you are our best. We are so proud of you, of the fact that you're in this caucus, and you've brought us you know, the participation of the DNC in our annual meeting, and so many words of wisdom. I can't even believe, I don't ever use that word, embarrassed or ashamed.
You have brought your legacy, an extraordinary legacy in this organization. You have done so much for this organization throughout the years in so many ways that people look up to you as an icon, Ken. I can hardly believe I'm hearing those words out of your mouth, and you continue every day to contribute so much.
Yeah.
Ken, I have a question for you from what you said, two actually. One is, what can we do at DA events for maybe people like yourself and me who sort of wilt in the heat? And the other is, what advice do you have from going to being a caregiver to having a disability yourself, or being prepared with these emergencies? Thanks.
Well, survival instincts are usually met, wrestled with, and it's the company of friends and patriots that make it possible for us to persevere. I don't have any great words of wisdom. I participate in, I try to participate minimally where I can, and work for the best. I keep wondering whether I can get on the telephone and make all these calls like I used to, and be clear on the message, and not waste a phone call. So it's easier to pay for phone calls for somebody else to make.
Well, I think we all have to contribute in the way we can. You know, for some of us, the whole Zoom. Speaking of heat, I have the same issue, and I think Zoom has been like the best thing ever in a funny way. The pandemic driving people online and to being part of a community and being able to see people without having to figure out how to get yourself dressed and out of the house, well, showered, changed, out of the house, walking to the car, driving safely wherever, the whole thing. It's a big deal to go somewhere. And it's been like, fantastic to me to be able to have this community of people and Democrats abroad who are, just looking at the screen right now, just this fabulous group of interesting, intelligent, committed, amazing people who teach me stuff and who listen to me unbelievably, and so on and so forth. It's just been wonderful. And I think for Ken, I don't know if you agree, but I think for people with specifically mobility or like difficulty being in environment situations, I think it's been helpful. It's been really helpful, and it's sustained us in a funny way. And I think
It's
it
been
would
a blessing
serve us
in many ways, even though hearing
Yeah.
disabilities.
Yes.
We have closed captioning. We don't have to deal with ambient noise and not being able to communicate in a large group, because we've got the text right there. We can read it. But I want to turn to Inga, has had her hand up and wanted to say something. So Inga, could you please share with us?
Yes, thank you. And thank you so much to Marnie, Liz, and Ken. It's been really interesting to hear your perspectives and hear the, what is urgent to you and how much overlap that is with the work that we do on the ECCC and thinking about the climate change. And there are a couple of things that come out to me. I kept hearing these sort of themes. And one is community. You're all talking about how it's not just the local community, although, as Liz was saying, how important that is in an emergency situation. And we sort of ignore that at our peril and how much that could help, but also the wider community, the global community that is grappling with these problems that cannot be handled by individuals, that cannot be handled by states. Another thing that came out, particularly with Ken, was talking about kind of kindness and about how important that is, and understanding the human elements and not treating people like numbers, but allowing time to care for each other and to reflect, as he did on his walk. And the third element I thought about was just common sense, for God's sake. Why not build in things to our technology, into our built environment? And boy, is Zoom a game changer. You're so right. I have heard this, when the lockdown came and we had to switch to virtual meetings in the UK, a number of people I'd never seen before showed up. Well, why? Because they couldn't attend our events in person comfortably. So that's been enormous. If I have a question, I guess it's maybe to Marnie, but maybe you others. Are there examples of countries where they have been more engaged with disabled people and climate change issue? Are there sort of some good examples that could inspire us that you think, gosh, this country or this region or whatever is getting ahead of the game a little bit? Maybe there isn't, but I'm just curious if that exists. And again, thank you. It's been very interesting.
I wish I knew the answer to that question, because I've heard little bits and pieces from different people, but I've never thought to ask. That's why I was fascinated with this idea of doing a little bit of research with our members to explore what's going on in the different countries, because maybe there are some ideas out there that haven't been quite captured in the way that, and what is that famous word these days, amplified, out to everyone. So that we can all take advantage of the thinking. I know, well, I think we've talked about it. The situation in China is particularly got some big pluses and big minuses, I would say, right, Liz?
Yeah, and it depends. I mean, I think that instead of maybe focusing on one country in particular, there are some international sustainability platforms that focus on research and science policy, like Future Earth. I think the IPCC, and they can help ensure that disabled communities are informed and actively engaged. I think that's, but we do hear bits and pieces from folks abroad as to what works and what doesn't, but there's no one great answer other than community and communication and sharing, knowing how to recognize when someone's disabled and actually listening to them when they tell you I'm disabled, because it's a loaded phrase. There are so many things that come along with being even able to say I'm disabled, right? You don't know what a person has to carry with them and their struggles and barriers through the day. So I do think American conservation and environmental policy is some of the best around the world. And I love that we're striving to improve it. I love the new IRA. Yeah.
I think that,
well, I was just
Nordic
basically going to
countries-
say disability equity needs to be a key component. Sorry, I think my connection's off.
Sorry. I wanted to say, I think that along with many other issues with Social Security, a social security net, that the Nordic countries are pretty far ahead of most of the other countries. However, and I live in Finland, I'm calling from Finland, I'm a Texas voter. The way that mental illness is addressed, I think may be a bit further behind. So how they define disability. So if somebody has Alzheimer's, or somebody has a physical disability or an illness, but there are many kinds of disabilities. And so in some respects, they may be at the top of their game in preparedness, and in other respects, because they're late to the game, recognizing other types of disability, they may be maybe not as effective.
When we talk about this, and when Ken talks about being kind, that I think putting aside disability, I think that the philosophy of being kind, and the philosophy of, there was a organization I was talking to, and their whole approach is always, in going in to solve a problem, is ask, listen, act. And we don't do enough of any of those things, I think, but to take things in that just simple way is so useful. But I think, the asking part is difficult for a lot of people. But as anyone stands in front of you, I say this a lot, and I apologize for repeating myself, but I really think as anyone stands in front of you, you can be darn sure they're carrying a big load of crap. And they're lost someone, they have some sort of pain, physical pain and mental pain. They have a huge debt looming over their shoulders. Their children are sick. Something. It can be big, it can be small, but in any given day, almost everybody's got some stuff like that. And I think that just in a better world, I saw the better world sign there. In a better world, we would all, as Ken suggested, just give people the grace of forgiveness. If they're rude to us, be nice. If you're going to reach out and ask someone for something, be nice, do it nice, play nice. And I just think that that would yield better consideration, would yield better results in any situation, when you're trying to solve something so humongous as, we should do it as you said, like back to community. We should do the solving as a community, as a group, and then so we're all saving ourselves, so that people with disabilities don't at the last minute have to be screaming and crying and begging for help, so that we're part of preparing, so that we don't need to ask, so that it's there. Sorry, little speech, small group. I'm sorry, please forgive me.
It's beautiful.
Yeah, that's absolutely true. I just wrote in the chat box, look left, look right. 1 in 4 of us are disabled. Someone you're looking at is probably impaired, whether you can see it and recognize it or not. And a lot of disabilities like mine are invisible and develop over time, and they ebb and flow. So being prepared at Sarah voter registration events is something that we've been talking about. Marnie has led the way in our Disability Caucus calls. And so that's having chairs available, being near accessible bathrooms, not just a bathroom, because abroad you never always know what you're going to be getting, but making sure that an able person can access it comfortably, and then making that extra consideration for a disabled person, and providing shade for people like Ken and I who wilt in the heat. Thinking of indoor and outdoor space at these events is essential. And I think Sharon had a great point. We should definitely ask people before an event to tell us if they have a special need, so we can take it into consideration.
Definitely.
Whether that's a food allergy or they have a visual stimuli that they need to be cautious of, then we can take those elements out of our presentations, and we can make our presentations and our speeches louder. We can get a mic if we need to for the hearing impaired. But any other suggestions, please, we're willing to take them in and listen, and we appreciate them greatly. They help each of us directly.
I want to briefly bring it back to voting and climate change and disabilities. And I would like to share experience. I'm from Texas. I'm a Texas voter. My whole family's there. And I don't know if you all heard or remember that in 2021, there was a terrible freeze. My 90-year-old mother was without power and water for a week. She had to sit in front of she had wood in her fireplace. She survived, but hundreds of people died. And most of those people that died were people whose healthcare providers couldn't make it because they didn't have transportation, or their electricity was out, so that machines that they needed to survive did not function. They couldn't move anywhere because they didn't have power for their wheelchairs. I mean, it was a sickening situation that could have been avoided because of that political situation in Texas, individual grid. The only systems that were working were actually the renewable energy systems. It's such a clear case of your vote to
Save your life.
will save your life. For railroad commissioner, for lieutenant governor, for governor, will save your life. We were lucky this summer because it was an incredibly hot summer in Texas that I was having in the middle of a climate cafe in July, and the power went out. You know, how often does your power go out? Maybe in China, not in Finland, because of the grid, but that it didn't go down long term, and that's because of renewable energy there. Texas is the largest provider of wind energy in the country and second in solar, but the oil people own that state, and they have it so tied in with the fossil fuels that its own grid, it creates just a perfect storm of problems. It's incredibly important that we're able to communicate the message. In Texas, not only do we need to vote for women's reproductive rights and safety and gun control and separation of church and state and everything else that we hold so dear, but it will save the lives of those with disabilities because of the problems with the grid.
Absolutely.
Yeah.
And you hit on something right there, and that is properly taking care of one another is funding the government. The government is essential. So very often we hear this counterpoint: I vote conservative because I'm fiscally responsible. Well, guess what? You're cutting the Department of Energy funds. You're cutting our emergency first responder funds. You're cutting FEMA and all of this aid that we receive. People don't really know what the Department of the Interior does in terms of security. People don't really know what the Department of Agriculture does in terms of helping us with our medicine and our foods and making sure that that's secure. These are amazing things that are also uniquely America, and America does them well. When we fund, we can function. And that's another key tenet of why we need to vote blue this November. These are essential services that save the lives of the disabled like us, and everyone in America benefits from these programs. So I really hope people can take that into consideration when they're voting and vote up and down the ballot as well. You have to start at the municipal level and build your way up to that senator or governor, like we mentioned Abbott in the chat box just now. It's not just him. It's not just those big seats. You have to start somewhere. Please vote in midterms 2022. And I'll let you take it away. Just one of those things that you can go on forever about. And for those of us voting abroad, we need to talk about votefromabroad.org, which I think now is even more accessible. If it's not accessible for you and you're watching this call or on this call, tell us. Contact the Disability Caucus and we'll figure out a way to make it more not only ADA compliant, but usable and user-friendly for you. Our goal is to have these events so we can have something on paper, have something digital, and help you through that process. We do that hybrid, live, on the internet, and that's really our number one function. And Sharon, you're right. That is a great book. She recommended The Fifth Risk, and that's something I believe DA UK had read, and we subsequently read here in China. It really was, and it's a very sort of structured discussion of what each department does.
Yeah,
absolutely.
And how the Trump administration gutted those departments as he came in, and which really really crippled our capacity to respond in many ways. They thought, oh, well, the fifth risk, she's referring to the book Michael Lewis wrote, The Fifth Risk, that Sharon recommended. And it talks about, as he went through the transition, how he looked at the Trump administration. They didn't do any homework. They basically fired all these people, didn't replace them, and they thought, what do we need this for? This is only in the case of emergencies. So it really drastically crippled our capacity to respond to emergencies. The pandemic, all kinds of emergencies. And it was it was so prophetic. Thank you, Sharon, for bringing that up. Michael Lewis is a great writer. Wes, would you like to, we heard from you. Where are you calling in from? I see you remarking in the chat.
Hi, can you hear me?
Yes.
Hi, I'm sorry my video is not working.
Okay.
It has its mood sort of like I do. My video camera doesn't want to cooperate today. Yes, I'm in Bellingham, Washington, up in the Northwest. But I try to get a lot of, try to stay in touch with Democrats abroad and vote from abroad as much as possible, because I work with a group here that tries to work on this end to support candidates and campaigns who aren't really aware, like down ballot campaigns that we work with aren't really aware of what an overseas or military ballot is. So these are a lot of the people that we need to reach out to build overseas military voters, get out the vote effort. And a lot of them aren't really aware of what that means. It's sort of a term that doesn't enter your consciousness and maybe until election night and you're waiting on them. And a lot of candidates do end up winning on votes from overseas and military ballots, and they might wish they had learned a bit more. So we're trying to inform them and inform
Thank you so
other
much.
get out the vote groups here. And our strategy is really everybody here in the here being in the States knows somebody who votes from abroad, but they may not realize that they know. And so we try to spur them to think, well, my cousin is in the Coast Guard, or my aunt lives in France, or, you know, retired neighbors, you know, moved to Costa Rica. There's, you know, somebody in your network, in your world. And our strategy is to try to get people to realize that and reach out now, sooner rather than later, so that they can get their ballot requests in, sort of understand how it works, and then how easy it is. Honestly, it's a lot easier than a lot of people think. And just sort of breaking down some of the myths around it. You don't vote at the embassy, you don't, you know, you don't have to mail it in most cases, that sort of thing. So it's a lot easier.
You do have to mail it in most cases. It depends on the state. There are 20
yeah,
states out of the 50 where they require a mail-in ballot.
In some states, yeah. We work with North Carolina a lot, which is one of the easier states. So we do a lot of just sort of trying to spur people to reach out to the people they know, and that's our mission or our hope. And I put the link to our group in the chat. We're basically grassroots volunteers who are trying to boost turnout for all the reasons that you mentioned.
Well, we're so grateful that you joined us today, Wes.
Thank you. Thank you.
Thank you for the work that you do, helping us help America.
Sure, helping each other, as you said. It's all about helping each other. So
helping each other.
I have a huge interest in, because I am a person with a disability myself. It's one of those invisible disabilities that you spoke of, and I'm glad you did, because it's not something that you either want to or feel you should explain to people, but it's real, and it does affect daily life in a lot of ways. So thank you for being here and having the conversation.
That's great. Well,
And
I think a
Wes.
wedding, we should have a wedding between Wes and the people that vote from abroad, and maybe we can clone some offspring.
I have a little story to
Well,
tell you.
we work with them a lot. I was on a call with the
Good.
Democrats abroad state team yesterday, and sometimes it's in the middle of the night when I'm here in Washington State, but I'm glad to do it because I don't sleep on a quote unquote normal schedule anyway. So
I have a little story to tell you, because I think we're getting near to the closing remarks. In
Share with us, Ken.
2013, I guess I was vice chair of Democrats Abroad at the time. And those years, the White House always invited the leadership of Democrats Abroad to a Christmas party. And I got an invite from the party, and I was open to bringing a guest. And I thought of my 100-year-old mom, who living in a studio, her studio 61 years in Carnegie Hall in New York, that she loved the opportunity. She had voted for the first time that we knew in her life the year before, casting a vote for Obama. And so she dressed for the occasion. We got into the Eastgate line at the White House to get in. And after standing for an hour, they began to let people in. She got up to the gate, and we couldn't find her. They couldn't find her okay, that she could get into the party. I had registered her, but they hadn't found it. Well, anyway, they took about an hour to get it. My mom was standing there, 100 years old, for her second hour. And I better get her a wheelchair. She's not going to survive this trip into the salon where they're feeding people. And so eventually, after 2.5 hours, we got her in, we were able to mosey around the 6 salons that had food service. We kept waiting for the president, and he eventually showed up and coming down the stairs with Michelle. And I said, well, how can I get close enough that my mom might be able to shake his hand? And he began his speech and reminded us to think of our children. This was the day of the massacre of the children in Connecticut. He'd just been delayed trying to console the people affected in Connecticut by the brutal slaughter. You know, I'm sitting talking to one of the staff, and I look down it's a wheelchair, to tell Mom. I said, we can head over to that door, and I think we can get a chance to greet the president on his way out. When I looked down, she wasn't in the wheelchair. She had gotten up and disappeared into the crowd. I said, where the hell is she? How am I going to get her? This wheelchair is here. No, I went out to the far end when he finishes his remarks, and he was going out to the side door. I leaned over 4 people and gave him a handshake, a double hand, and said, peace to you, Mr. Prez. And he turned around and to you. And I said, where's my mom? I looked at the crowd, there were about 600 guests in the room. I can't see her. And then as people started to disperse, I looked over there at the other door. It looked like she was sitting there talking to 2 guards who were monitoring, keeping people in place. And I said, I go up to my mom and said, what happened? She said, she's crying. She said, Kenneth, you can't believe what happened. The president said, and who are you here with? And I said, my son Ken. The president turned to everybody in the audience and said, is Ken here? I didn't hear this. Is Ken here? Then my mom said, he looks at Michelle, and she thinks to herself that he's jealous because I look so beautiful. And they insisted she take a picture with them. I have this picture overwhelming her with Michelle, the president, and signed by them as a Christmas gift.
That's amazing.
What a fabulous
It's
story.
worth a lifetime of dedication and participation of Democrats abroad to have that opportunity.
Quite a special,
And
yeah.
now all the DNC delegates have an invite to Tuesday the 13th to the White House to share with President Biden his opportunities signing the reduct the whatever we call the
Inflation reduction.
yes, the new act.
Yes, they get to go to the White House.
They said you can get to you can stand in line for 3 hours to get to the gate. They said, if I go down there, I'm not going to be able to sustain the standing up for more than 25, 30 minutes at best, if lucky, not without
Yeah.
collapsing. At any rate, it's a life to
We're glad
enjoy.
that you're there. Yeah, I think, is that the second week of September, which is also kicking off Disabled Voters Week? So what a great time to be there as our DNC rep, Ken, and our Disability Caucus lead, and be able to say, we need to turn things around. We can't wait in line for 3 hours.
Turning around after a DNC meeting, going home on Saturday and coming back to the White House. And my daughter bought me tickets to see the Blue Jays on Tuesday night. So I took it. So I could give up a baseball game.
Ken, that is the best story about your mom. I'm going to
love
remember
that.
that one forever.
You can't forget it.
Do you have the picture framed at your house?
Yeah, well, wait a second. I will show it to you.
Oh, yay.
Ah, oh, yeah.
While Ken gets that, I just want to make a plug that we also need to keep reminding people to wear masks, because COVID is still raging around the country. So whether at a vote from abroad, Democrats abroad event, or back home in America, the disabled community is disproportionately impacted by the virus. And so we really need to be mindful of those around us, and maybe even have a few extra masks at some of our events. We do here at our events at DA China. There it is. Oh, it's
Oh
huge.
my gosh.
Oh my God.
Oh, she did get dolled up. Look at that. Oh my God, she's gorgeous, man.
Fabulous.
That is gorgeous.
Gorgeous. Thank you
Can we-
so much for sharing.
Well, I want you to see.
I want to put that on our webpage.
I want you to see my mother's hand.
Gorgeous.
Oh.
Like
She's
a
a
Yes.
beautiful woman.
Oh, that's so nice. Yeah.
See her hand?
Yes.
Yeah.
Yes, that's perfect, Ken.
She's holding on to him for life. That grip she has on his wrist.
My goodness.
Thank you for sharing that, Ken.
I wish that when I get to be 100, I think I'm going to really wish I had a son.
I'm so thrilled that we could have this discussion today. Are there any, apart from, please register, make sure that everybody you know is registered to vote inside and outside the United States. I think we all know the drill. Are there any closing remarks that you all would like to share?
I feel like I'm on a high after that story. I think I don't want to bring it down. Let's stay there.
I don't think you will. I think that being accessible and incorporating all of our communities within DA is great. I love the collaboration. I hope we can do it again. Someone just wrote in the chat box, when's the next meeting? I hope that we can collaborate on another event, and we'll also keep attending the ECCC Climate Cafes.
Absolutely. I want to remind you or share with you that our next Climate Cafe, we just set the date, will be September 28th. And often we try to intersect with another caucus, but for this one, with this amazing new Inflation Reduction Act, which has come out, people are still sorting through it and trying to understand what the implications are and how it can affect them personally. So we're going to present a kind of IRA toolkit and how people back home can personally increase their energy efficiency and utilize the different rebates and tax deductions for their own personal lives, just to try to unpack this a little bit, what it can mean to individuals. as an information session. Again, as always, a discussion, a conversation where we all learn together. So I'm
Yeah.
thrilled that we
I look
could
forward to working together in the future with lots to do. There's always, they keep coming up with more stuff that we have to do. And we keep plugging away, and it's wonderful to have such a great team.
So with that, I will say goodbye and look forward to collaborating with all of you and seeing you next time. Stay
Thank you.
healthy.
See you on the
Thanks, Dana.
28th.
Thank you.
Stay
Take care.
Thank you.